Coronaviruses are a large family of respiratory viruses that cause diseases ranging from the common cold to the Middle East Respiratory Syndrome and the severe acute respiratory syndrome. The current coronavirus was identified as the causes of severe acute respiratory illnesses, now referred to as COVID-19, that broke out in Wuhan, China in December 2019. The virus is transmitted through direct contact with respiratory droplets from an infected person and by touching surfaces that are contaminated. These droplets are produced when an infected person talks, coughs, or sneezes. The virus can spread to the mouth, nose, or hands of people nearby or who come in contact with infected surfaces and can possibly be inhaled into the lungs. Symptoms may appear 2 to 14 days after exposure to the virus. Note, some people never develop symptoms but can still transmit the virus to others. Symptoms of coronavirus can include fever, dry cough, shortness of breath, muscle ache, and generally fatigue. In more severe cases, infection can cause pneumonia or breathing difficulties. Rarely, the disease can be more fatal, but that's mainly among the older people, especially with pre-existing conditions. Currently, there is no vaccine or specific treatment for COVID-19. For all infected persons, they should receive care to relieve the symptoms, while those seriously ill need to be quarantined or hospitalized. The best way to prevent illness is to avoid being exposed to the virus. Regularly and thoroughly wash your hands with soap and running water for at least 30 seconds or use alcohol-based hand sanitizer. Maintain good respiratory hygiene by covering your mouth and nose while coughing and sneezing with a disposable tissue on into the flexed elbow like this. Maintain a safe social distance of at least 1 meter between yourself and anyone who is coughing or sneezing. Avoid handshaking, hugging, and kissing with people who have flu-like symptoms. Avoid close contact with anyone who has a fever and cough. Persons with a cough or sneezing should stay home or keep social distance and avoid mixing with others in a crowd. Avoid touching your face, eyes, nose, and mouth to prevent transmission. Regular disinfection of all working surfaces, e.g., workstations, tables in meeting rooms with disinfectant diluted bleach. Avoid all public gatherings, meetings, and events, including places of worship, social gatherings like weddings and funerals, crowded places, for example, shopping malls, and entertainment premises. Limitation of visitors to hospitalized patients in public and private hospitals. Avoid all non-essential travel, including local travel. Minimize congestion in public transport wherever possible. If you have a fever, cough, and difficulty in breathing, seek medical care early and share your travel history with your healthcare provider. Stay at home if you feel unwell with symptoms like fever, cough, and difficulty in breathing for 14 days, which corresponds to the incubation period of coronavirus. Cover your mouth and nose with a cloth face mask when around others. Everyone should wear a cloth face mask cover in public to avoid spreading or being infected by the virus. Masks should not be put on children under age 2 or anyone unable to remove the mask without assistance. Remember, the cloth face mask is not a substitute for social distancing. People are encouraged to stay updated with information from trusted sources. For example, the Ministry of Public Health, World Health Organization, Center for Disease Control and Prevention, etc. All suspected cases of coronavirus are being referred to the Ministry of Health if confirmed. The Ministry of Health shall coordinate the referral process to an appropriate facility for management of the disease. The Ministry of Health has provided the following toll-free lines if you have symptoms of the COVID-19 or you notice anyone with symptoms or suspected death from COVID-19. Save yourself and your community by dialing 1510. For those living specifically in the northwest region of Cameroon, dial 233-631-503 or 677-564-650 or 677-032-723. They will provide the necessary guidance on coronavirus, including referral to the appropriate facilities if coronavirus is confirmed. The coronavirus is spreading like fire, but together we stand. Together we are strong. The COVID-19 has no future in the northwest region. Stay safe.